to the next topic. In SICS, definitely training is required, and one of the mode of this training is simulation. So I request Dr. Jatinder BALI to speak on simulators in ophthalmic surgical training. The discussions will take at the end of the topic, so I request all the discussants and the delegates be here for any clearance of the doubts.
Good evening, ladies and gentlemen. At the outset, I want to thank ISMSICS, the founder members, Dr. Sahu, Dr. Boramani, Dr. Deepak, and the Asia Pacific Academy of Ophthalmology, the All India Ophthalmology Society, for giving me this opportunity to talk to you about simulators in ophthalmic surgical training. Well, today I'm going to tell you the story of, it's a very interesting story of a man who fell from an aircraft while teaching somebody how to fly an aircraft, landed on power lines below, and from there to the ground without a parachute. He survives that, and after that what he does changes the way we train pilots. Then he goes on to change the way we perform cataract surgery, and then how we train our people how to perform cataract surgery. I have no financial disclosures to make for this presentation. The first question that comes to mind is, why are we talking about simulation today? Well, we talked of reducing errors. We don't want a rookie pilot to learn landing an aircraft with a fully loaded aeroplane in which you are traveling. Would you like to do that? Any one of you? No. So that's exactly what we want to do. We want to give a risk-free environment within which repetitive practice can be performed to reduce the surgical errors, increase the confidence of the rookie surgeon, develop his skill, and retain that skill. There are many examples of different simulators which are available. I won't name them. We will be focusing on one of them because Help Me See has a simulator which has simulation training for manual small incision cataract surgery. So I talked of a pilot, I talked of how cataract surgery got changed, and I talked of simulation. Disparate things, but allow me to start my story from the very beginning with Alfred Yulchi. He was the founder of Flight Safety International, which was a pioneer in modern flight safety simulation training, and he is one of the heroes of aviation, ranked at number 13. Now, so far as Yulchi's early life is concerned, he was born in Kentucky in 1917. At age 16, he starts selling hamburgers in a hamburger stand called Little Hawk Hamburger Stand. And do you know why he's doing that? He is trying to raise funds for his flight school. From the profits of that hamburger stand, he purchased a Waco 10, learned flying, funded his flying from these profits, became a flight instructor, was hired by the Pan American. Then there was that very famous incident that I talked of, and he founded Flight Safety International in 1951, which has the motto, the best safety device in any aircraft across the world is a well-trained crew. So how is it related to this video at the bottom that you are seeing? Is the simulator in action, in practice. And he has been instrumental in development of the simulator. Now, Flight Safety International, what did it do? It initiated a training revolution by identifying the gaps in corporate pilot training, and then developing realistic flight simulators. This particular company became very rich and was subsequently acquired, and Yulchi moved on and founded something called Orbis International. He was one of the co-founders, and he got involved with the Flying Eye hospitals, which conducted large number of cataract surgeries across the world. That was where he realized that there was a shortage of well-trained cataract surgeons. He saw a potential in simulation-based cataract surgery training. And from these funds, he initiated, laid the seeds for Help Me See. And we have some of the pioneers who started the journey with him. And it is today a complete training suite which is there. We have a Help Me See India team, some members of which are here present, led by, I think, Dr. Chetan Anewale and Dr. Kemeya. And many of our members have been instrumental in the development of all these modules that we're talking of. It is also, we have been part of the collaborative training program in training cataract surgeons using these, using the simulator. We've already talked of what are the benefits of using this. Cost effectiveness and reduced stress on the surgeon is one of the key takeaway messages in terms of the use of the simulators. The future of training is definitely augmented reality and virtual reality. Albert Yulchi is no longer with us. He's passed away around 10 or 12 years ago, but his legacy lives on. His life epitomizes, the change that one single human life can bring to millions of people across the world. And I love it when Dr. Sahu tells the youngsters that you choose what kind of a legacy is it that you want to be remembered by. So my exhortation to you, as is with him, is choose wisely. Thank you, ladies and gentlemen. That was my time. I hope I've done justice to the subject. Thank you, sir.
Thank you, Dr. Bali, sir.
Thank you, Doctor. I had the privilege of meeting Mr. Al Yulchi in AO 2011 when they had parted from Orbis, because Orbis would be doing a lot of training, and Al Yulchi believed that training conventionally was not perhaps the way to solving the developing world's problem, and we needed to completely think differently. So even though he was the founder of Orbis, after spending 25 years there, the Orbis board was vertically split and Help Me See was found. And that way, India or Indian software played a small role, because for the first 5 years, this simulator was developed in the city of Pune in Hinjawadi. So it was Indian, US, Czech and Finnish collaboration which made it. And of course, Chetan and Kemeya and our own, your lead, the first ones, they are the ones who had started and worked on it. And now it is not just for SICS, because they realize that it is one part, definitely, but there is so much more to be done. Because when we look at all RAP surveys around the world, the fourth or the fifth leading cause of blindness is cataract surgery complications. Yeah, so we ophthalmologists also have to do it, and I think that is where ISMS-ICS with its quality surgery comes into picture.
Thank you, Dr. Parikshit, and thank you, Dr. Bali, sir, for linking the history to the present and future. We've just heard about different nucleus techniques, and in SICS is one such surgery where practically every second, third surgeon has their own way of nucleus.